your intro and what it is about. Don't worry, everything is okay. what we're speaking about?
Yes, absolutely. Well, good afternoon. Pleasure to meet you all. My role is probably to briefly introduce the topic. It's extremely simple. The accession time and to what extent all institutions, civil society organizations, and experts, etc., governments involved in the process of supporting the accession to EU as far as good practice or best practice as far as drug policies are concerned. So I might say that very briefly that we wish all 7 parties to be successful at the end, even though we know that it's a long-term process. I see that as an opportunity just to really not only adjust the national drug strategies in terms of public health centered and human rights oriented and harm reduction based effective or cost-effective drug policies should be introduced, from my perspective, even going behind the normative practice in EU countries. So from my perspective, it's a challenge to go further, not only to adjust the national drug policies in all countries you represent towards so-called EU standards, because I am not convinced that EU standards are enough. And as we see the discussion around the last EU strategy and action plan actually adopted, with all these focuses at the law enforcement side, still clearly, that for me, it clearly shows that EU in general does not really go in a way it should be. And I am open to, or we are open to listen to you. What are your plans? Many of you knows that HANA and EHRA and Global Commission on Drug Policy and our regional commission on Eastern Europe and Central Asia. We are for a long time involved in assisting EU the introduction and implementation of the good and effective drug policies. So I'm very much open to listen to you, and we are here. Can talk on behalf of myself and maybe a little bit on behalf of the government of the Czech Republic. We are just ready to assist you.
Thank you. I guess we are coming now to the opening remarks from the Cyprus Presidency, and they are very welcoming you to speak on behalf, like, European Union, I guess now, also Cyprus. Josefina Mavrou.
Thank you very much. Good afternoon, distinguished colleagues, representatives of government, civil society, and international organizations. It's a pleasure to open this side event on EU accession as an opportunity for human rights-based and balanced drug policy reform. I would like to thank you and the organizers and all the partners for this invitation and for bringing this important discussion to the CND. As Cyprus, that currently holds the presidency of the EU Council, we will emphasize the human rights and balanced approach in the implementation of the EU drug strategy. The EU accession process is not only a technical process of legal approximation, it is also a process of institutional reform and alignment with core European values, including human rights, public health, the rule of law, and social inclusion. In this context, drug policy matters. It is closely linked to the key accession areas such as fundamental rights, health, justice, and social policy. A balanced drug policy must go beyond punitive responses. It should be grounded in evidence, human dignity, and access to public health services. This includes prevention, treatment, rehabilitation, harm reduction, and support for social reintegration. It also means addressing stigma and discrimination and ensuring that vulnerable groups, including people in prison settings, are not left behind. This approach is fully in line with the EU's broader drugs policy framework. In December 2025, the European Commission presented a new EU drug strategy for 2026 ongoing, reaffirming the importance of a balanced approach grounded in scientific evidence and strengthening coordination, preparedness, international cooperation, and the exchange of experience and best practices across countries and institutions. The accession process offers candidate countries an important opportunity to strengthen national frameworks, improve coordination, and promote reforms that are more consistent with EU standards and international commitments. At the same time, it is important to ensure that these reforms are not only adopted on paper, but translated into real improvement in people's lives. Today's discussion is therefore both timely and important. It allows us to reflect on how EU accession can support more humane, effective, and rights-based drug policies, and how these reforms can contribute to stronger public institutions, better health outcomes, and closer cooperation among partners. It is also an opportunity to promote mutual learning and the exchange of best practices in support of sustainable and meaningful reform. I wish you all a fruitful and engaging side event with constructive exchanges and practical reflections for the way forward. Thank you very much.
Now we will give the floor to Marie Aude. Tannou. I'm sorry, French is not my first language. And from European Commission, from DG Home. And actually for us, as a people who are working in the region, it's important to hear from European Commission, do you have tools to help countries to implement the better policy?
Thank you very much. Thank you very much indeed for inviting us to take part in this event. It's very important. We're very much attached to the enlargement process, which allow us to go towards a gradual integration of the third countries into the European Union and eventually make a stronger European Union. How does that work? There are different criteria. There's a political criteria, and here the Cyprus presidency have highlighted democracy, rule of law, human rights are overarching criteria, which are important throughout across the board. There are economic criteria, I'm not going to go into them. And then there is the EU acquis, and I think that's what a bit we're discussing based on the leaflet that was distributed. The EU acquis, it corresponds to adherence to the EU principles as per the treaties, but also to the EU acquis in terms of legal framework of the EU. And what is the EU acquis in the area of drug policy? Mainly it's in the area of justice and criminal sanctions, indeed. But we do have certain hooks as regards the European Union Drugs Agency. So this is what we're monitoring as part of the stricto sensu accession process. But with that, we do have books to cover the overall drug policy because we cannot ignore in this accession process review any chapter negotiation that we have the EU drug strategy, the new one which has just been adopted, endorsed by the member states just last week, and which is balanced, which is calling for balanced policies, which is based on human rights, which is based on integrated and multidisciplinary approach. So we're promoting that throughout our discussions with accession partners. So what does this mean? In the sense that we're looking at the transposition of legal acts in the member states at results. At the same time, we're also taking the opportunity of the accession process as an opportunity to discuss, to cooperate. And indeed, you just highlighted that whether we have tools to cooperate. So based on this accession process, we also have projects and programs which we're implementing with the different partners in order to improve the situation, to foster different drug policies, to foster the integration, for example, with our European Union Drugs Agency in the countries. So that's what we're doing. I mean, you might know that the European Union Drugs Agency is particularly active in this field. And the last thing I wanted to highlight also that beyond the accession process, cooperation and international cooperation, in particular with our accession partners, is a key aspect in the new drug strategy. The entire basis, in French, the socle of the drug strategy is cooperation with partners. Cooperation with international partners is a big part. Cooperation with other partners, including civil society organization, is another part. And as regards international partners, if you look at the strategy, we're very much emphasizing the importance of accession countries. So I just want to highlight that besides the accession process, we do have other tools. The strategy is a bit the framework for that. We have drugs dialogues, which are led by the presidency in the council, which we have every year, and where we're indeed discussing the progress of and the development, the progress of accession countries and the developments on both sides. Overall, the process takes time. It needs to mature, but we're seeing efforts, and we're glad to see that there are already some results. There is more to do, but we're looking forward to working together in the future on that. Thank you.
Actually, we're coming to the analysis with which Adria Fernandez did for Eurasian Harm Reduction Association with support with the partners. And first of all, multi-country ISOS project and Alliance for Public Health. This analysis for us is a key to understand what are the keys and for civil society in our region, specifically working to provide harm reduction, to provide health services in the drug policy, to understand where could we place this requirements for the drug policy reform and access to services. Andrea?
Thank you very much.
The methodology.
Thank you, Ganna. Good afternoon, everyone. Thanks to EHRA, to all the organizers for this important event. For me personally, it's quite meaningful because we've been working on this issue for months, and it's just beautiful to be able to share it with people who are interested and committed to this matter. I would be remiss if I also not congratulate Pavel for your appointment.
Thank you.
All the eyes are on you, so good luck for what's coming.
That's demanding.
That's So I'll just present a bit on the process we did of trying to look at the EU acquis on drug policy from a more capacious perspective, maybe than the one that Mario was describing now, and then how we have been developing a shadow reporting tool in order to operationalize it and to be able to monitor how the situation on the ground is changing. And I'll just say that we've been working on that shadow monitoring tool with EHRA for a long time. I don't know if you're going to give an update on how that's going at some point, but it's happening. And I was able to read one of the products of it, and I was really impressed at the quality of the information that came in and a real picture of the situation in the country, which can be useful for so many things, not only for accession. So change the slide, please. The start of our project is that we identify a gap between the approach to drugs and the accession negotiations and what we saw as the whole spectrum and the whole ambition of EU drug policies in general. And I'm going to go a bit more into that. We do believe that civil society shadow reporting can be a powerful tool to mobilize, to raise awareness of the gap, and to get change on the ground. And we would sort of do that on three steps. One is to redo that mapping of the EU drug policy commitments. Secondly, to identify the underlying substantial issues in there. What is the core of the commitments that are being made by the EU member states, and then to operationalize them into indicators that allow for consistent reporting across the years and across countries. That is very important. It's not a one-off experience. You can move there. So this beautiful design here, and credit to the European Commission's communications team for this. This is the mapping of the all the chapters of the EU accession negotiating framework. The fundamental factors. I think it's actually really useful. It sounded like I was joking, but it's actually a really good design. And what we did here was, first of all, to identify what were the chapters of accession negotiations that are relevant to drug policy, that contain commitments relevant to it. And they are fundamentally these four. There's a fifth one that I will mention in a second, and just in passing, but they would be the ones in the judiciary and fundamental rights, which is chapter 43, and justice, freedom, and security, which is chapter 24. And these two are the core accession chapters. They get open at the start. They remain open during the entire negotiating process, and they close the last one. So these are critical chapters and really good entry points to discuss drug policy, particularly chapter 24, as we shall discuss. We have chapter 28 on consumer and health protection, and then chapter 31 on foreign security and defense policy. And there's a requirement for candidate countries to align, or an expectation that they will align with the EU in international fora like the CND. There's also chapter 29 on the customs union, which applies to drug precursors. At this point, I always say that if at some point we regularize markets like cannabis for adult use in the EU member states, the EU will suddenly become an extremely important actor in drug policy, because some of these chapters, particularly customs unions, etc., will become spaces where the EU needs to enter into force and regulate drugs. So that's going to be very interesting if that happens. And we could move slide. The key was, where is drug policy there and how it's being applied at the moment. So we did a review of all the documents that get generated through the accession negotiating process to identify where drugs would emerge. We did see that there were particularly two chapters that did include explicit mentions to drug policy. And those was chapter 28, where there is one subsection on cooperation in the field of drugs, and that is always there. There will, in every EU accession negotiation, there will always be one subsection on drugs, which is in that chapter, and it includes precisely the acquis that Pavel was mentioning, right? It's basically the hard laws that the EU has at the moment, which is the early warning systems, the cooperation with the EU drugs agency, institutional frameworks on drug policy, such as whether the drug strategy or not, whether the drug strategy is balanced or not, etc. And then also enforcement indicators, which is a bit interesting. And then there is sometimes a reference to access to treatment, to OIT, but that's very inconsistent. So on chapter 28, we normally find literally one sentence. One sentence that refers to drug use and harm reduction. It normally says that there's been no change. It says there's been no change in drug use and harm reduction. And that tends to be in almost all European Commission reports. What is quite interesting to know is that there are issues in other chapters that are extremely relevant to drug policy, right? So in chapter 23, we have prison conditions, we have restrictions to civic space, we have torture and ill treatment, freedom of expression, gender equality, discrimination against ethnic minorities. And yes, drugs are not being mentioned, drug policy is being mentioned there, but we all know that this is inextricable for these elements. So what we want to do, one of the things we want to do with this exercise is to reveal, make obvious these things that are implicit, and get them into the shadow reporting methodology. Our diagnosis then is that in practice there's a narrow approach to what is the EU acquis that only focuses on the hard law of the EU, and it misses by now 10 years, because they really started in 2015, a bit earlier, with some prior drug strategies of commitments to a balanced drug policy that are pretty fleshed out by now, and they're very consistent. And these are non-binding commitments, but accession monitoring and accession negotiations do include often policies, political elements that are not hard law. And also we did identify some outdated language used in documents, such as drug abuse prevention, etc., which really indicates that, that's my opinion, that's not in the paper, but it does indicate that the people who are writing those reports at the European Commission, at the EU delegations in the candidate countries or in DGNS, maybe are not updated about what has been the more capacious and more ambitious EU approach that has been developed in the last 10 years. If I can change. Ganna, you tell me when I only have 2 minutes left, because
Okay.
I feel like I'm explaining all my work for the last 6 months, and I took 2 hours. So you tell me, please. What we did then is look at the entirety of EU laws and commitments, including non-binding documents, and we rated them as they were relevant to drug policy. We looked particularly those that were relevant to human rights and harm reduction approach drug policy. There's plenty of commitments and laws that concern the supply side that are there and are important, but they are simply out of the mandate, the scope of this project. They are very well followed by other actors. And we identified mainly 7 documents that are rated as high priority because they have clear and explicit commitment on what we are looking at, which are the 7 that you see here. After that, we did a review of these documents, and we saw, yeah, we can change one. Yes, thank you. And we tried to look at the underlying policy commitments that were there, again from a human rights and harm reduction perspective. And we sought to ensure we identified 40 commitments, which you will see in 5 seconds going through the slides. But these 40 key commitments, I think that the strength of the exercise is that they are grounded in EU documents, and in most, I would say 95% of cases, with 2 or 3 sources in different policy documents that have been adopted. So there is a political commitment for those things, and they are relevant to the conversation between the EU and candidate countries about how to shape drug policy. These are the 40 ones, so I hope you take them in. Yeah, I'll just say that they are divided in the 4 chapters that we discussed: chapter 23, chapter 24, chapter 28, and chapter 31. Yeah, and of course, one thing to say is that these commitments are not being fulfilled by member states nowadays, right? Like we all know, the member states nowadays fall short of achieving this. But what we're trying to do also is to go back to the value of the EU as an aspirational place, where we're trying to create a vision of drug policy that's more elevated than the operational law enforcement side, but it's committed to the values of the EU, which at the end is the whole basis of the project, right? This is not a project based on nationality, it's a process based on values of the EU, and that's what we're trying to achieve here. Then I'll go quickly to the shadow reporting methodology. Basically, the aim here is to be able to review every year the candidate countries' drugs laws and policies to see how they impact people who use drugs and to assess how they align with those 40 key commitments. This is just like the parameters we were working with, which is that we want data to be valid, we want to maximize reliability. So ideally, if different people did the same assessment during using the same methodology, they would get similar results. We want data to be consistent and comparable across candidate countries and across years, because we really want to be doing this every year. And we want it to reflect the experience of people who use drugs. And that's also a very important part of the process. Lastly, the data collection must be very, very cost efficient as we are. We're short on money, so it can't be too complicated. We got inspiration from the global harm reduction, from the global drug policy, and from the EHRA policy lab, and basically we tried to copy as much as we could from them because we didn't want to invent things from scratch. Another one, please. And at the end, we came up with policy indicators and implementation indicators. Policy indicators concern what's on the books, what's on the pages of a country. They can be collected just like desk-based research or by speaking to experts. And then implementation indicators are how those policies are actually impacting people who use drugs. And they should be collected by engaging with organizations of people who use drugs, with experts, through focus groups, surveys, etc. That will depend on the circumstances of every country and from the strength of civil society in every country and the resources. And we have 25 policy indicators and 41 implementation indicators, which are distributed across the chapters in the way that you see it here. And I think that's the last slide, which is that, the next slide should be the results of the reports, but we don't have them yet. So maybe just like a symbol, like a picture to symbolize that the reality is how we look at it, right? And any exercise of monitoring is an exercise of construction. So we're not looking at others, so we are building a reality. And yeah, let's look at this as well. Thank you very much.
Thank you. And I guess that this analysis inspired the Eurasian Commission to think what are the requirements, and I don't know how you will.
Okay. Now we move the floor to Michel. Michel Kazatchkine, EU accession as a catalyst for health and human rights-based drug policies. I have 7 minutes, but I would like to ask you, if I may. I was probably expected, and I don't want to have Olena being really angry on me. Spend at least 30 seconds on introducing the Eastern and Central European and Central Asian Commission on Drug Policy and just this phenomenal report. Thank you. I forgot that.
Well, thank you. So I haven't prepared anything. I didn't expect I would be a speaker at this event, but I really find it extremely interesting, and it has huge implications for countries, as everyone understands. And I'd like to congratulate Adria for excellent work. I would like to first say that it's obvious to everyone that what Josefina described as a European vision on drug policy, health, human rights, balanced, you used all these words, is in clear contrast to the fact that the strategy belongs to home in the EU, and to the fact that it is mainly Article 24 and 23 that are being discussed in accession for the countries, and that there's only one sentence in Article in what deals with consumer protection. So one of the main reasons, and I would also like to say that there is I see the same contrast between the EU Council, which is the institution of the EU, and the Council of Europe, which is a broader institution that is fundamentally based on human rights, of which the mandate is on human rights. And the Council of Europe and the Pompidou Group have, over the years, had an approach to drug policy which is in the words they use in contrast, sharp contrast with some of the EU language. So first I align with Pavel, not surprisingly, for the fact that we expect more from the EU strategy. And there are two reasons why I think the EU strategy is so late and why we see these contrasts that I'm pointing out. One is that the EU doesn't have a health mandate. This is the problem. And until we have a real health mandate and a real EU for health, there will be no home to discuss drug policy as health. So that's one reason. And the second reason is, of course, the political landscape and the general mood that is currently more on the repressive side than on the health and human rights side across Europe. And that may even be worsening in the near future. So in that context, our commission, and Elena, be prepared because I'll pass you the word in a second for the remaining 5 minutes. Our commission, which is one of the regional commissions associated with the Global Commission on Drug Policy. Both Pavel and I are members of the Global Commission on Drug Policy and also founding members of this Eastern European, Central Asian and Central European and Southeastern European countries, the Balkans, that are really on the accession process. Drug policy. This is a group of 7 people. Our commission is chaired by President Kwaśniewski, former president of Poland. And our mission is really to open the discussion, identify in countries of the region, and particularly in countries that seek access to the EU, the 1, 2, 3, I would call them silly legislations, yes, that really need to be urgently addressed, either because they could be an obstacle to reaching the acquis communautaire, or because they're just silly by themselves, contradicting basic policies based on health and human rights. We have been successful with in a few countries changing legislation. I'm not going into details here, but this is how the idea came. And Olena Kucherok, who is here, has been absolutely instrumental in leading and coordinating this work. We've generated this report, and we are very familiar with it, which has just been published and which we would like really to now distribute and to all organizations. I see people from various organizations working in Europe around the table to help trigger the process. Olena, would you like to please
I do.
say something?
Thank you, Professor. Thank you, Pavel. Dear colleagues and partners. So indeed, that is a quite detailed report, and that is both a kind of collection of technical issues on what are EU acquis on drug policy, what are requirements from the side of EU, and at the same time, what kind of obligations and expectations are toward candidate countries. And first of all, I want to say I'm originally Ukrainian, and Ukraine is one of EU accession candidate countries. I've been working on drug policy for almost 30 years already, and I want to state that EU accession is a great, great, great opportunity for candidate countries to make drug policy reform, because we know that it's not an easy topic. It's not an easy to advocate for positive changes. It's like much more easy to witness negative changes that has been going on currently within the region of Eastern Europe and Central Asia. Like we have a kind of serious backlash also influenced by the geopolitical situation in the region. So that's why EU accession is a kind of like really great, great opportunity to do these reforms. But sorry to say, actually many opportunities unfortunately are missing. Like we miss
that opportunity. And the reason for that is that mostly, like all requirements, all negotiation and negotiations framework by itself mostly focused on only some aspects of drug policy, those related to law enforcement, security, and inter-border cooperation, and so on. And yes, Professor told, unfortunately, there's almost nothing related to health, public health, human rights. And from this report actually calls for changes in the negotiation frameworks. We do believe that some changes should be done at the both levels, at the both sides. From one side, EU institutions, and first of all, EU Commission and Council of Europe, indeed might consider making changes within the negotiation framework to also include somehow health-related issues. And from another side, sure, we as advocates who work at the national level, that's our responsibility to continue advocacy, to keep our governments to be accountable and to push for human rights-oriented and evidence-based drug policy reforms in our countries. But one more time, indeed, there should be some changes at the level of EU institutions. It would be really helpful for us to do advocacy at the national level. Thank you very much.
Thank you very much, Elena.
Could we, I think, Josefina, it's a message also to Cyprus that you can bring to the Irish for the next presidency, and so the process starts that this issue, drugs are orphan. I'm sorry, we use orphan drugs for other understandings, yes, but are orphan in the system because there's no health in the system. So you come to Vienna, everyone talks about health, human rights now, and the system doesn't allow it for it. So if you could, we're already well into your presidency, but you will be talking to your successor. Please try and trigger that mechanism.
Pleasure to do that, of course.
If you need any support from us, we'll be more than happy to provide that. Actually, Czech Republic during the 2022 presidency has highlighted the health, public health, and human rights centered drug policy as one of the major issues. So it's possible to move it forward. So we are here just to provide assistance or experience better.
I guess that the one expectation which Adria said, we don't have the reports, and I'm as an executive director of Eurasian Harm Reduction Association, need to say that we already observe some outcomes of this process, and I will just share the short overview of impressions from the country, what is happening when this methodology, together with this political statement from the Regional Commission on Drugs, what is happening with civil society in the countries where we start doing the civil society assessment and this consensus. What we took as an approach is that civil society activists, experts, first analyzing the legislation, then mapping the existing mechanism of civil society involvement in EU accession and all institutions involved, and then doing the assessment of the practice from the community and civil society, what is happening with the same indicators in the practice. And first of all, from the mapping of institutions, and what I learned by myself, again, I'm from Ukraine, that's why I was asking everybody who are involved in civil society response to the EU on accession. And it's very strange because the very heavy involvement of the civil society is only in chapter 23 in human rights, and it's rather well structured, and the European Commission on the country level and on the Brussels level structure this chapter in the different rights of people. There are no people who use drugs. for sure. And nobody from the civil society who is working in the human rights area, they just don't have power to add on, because they are describing the freedoms, they're describing all the rights, but with the people who are drugged, they are really the orphan, like they're disappearing. And we are very happy for LGBT community, it is there. But all other, like I could not even imagine what is happening with sex workers' rights. So gender equality and LGBT rights, they are there, but the people who are drugged, they are not in this consultation. And the first move from our partners in the countries, from our members in the country, accession countries, is to be present in these meetings, to bring these reports, these community reports, to this big gathering of civil society and to European Commission. That's the first what we are trying to do to expand the human rights chapter. And then again, with the other chapters, with the access to health services in prison and in freedom, it's also very specific, because prison department is reporting, and it is not expected that there could be civil society working in prison. But it's true for Moldova, Georgia, and for Ukraine, it is completely true, and they are implementing absolutely amazing services in prison, in cooperation with the Department of Punishment. But that's the reality, but there are no this space. So it seems like with these indicators and with this report, we are squeezing in somewhere where we were not expected. And especially for the countries of Western Balkans, I could expect that, like, their accession process is so long already, and our colleagues from the drug policy network of Southeast Europe, they were trying to report what is happening with these negotiations with the drug policy for all of these years. And now we will step in together with them, in cooperation with them. So what I need to say as a first observation, it's not just providing report and using all this mechanism of civil society reporting. Our findings here, and findings are natural. We all know where the gaps in the services, or where the findings, where we could be proud of the country, where the gaps in community participation and developing strategy. We all understand this, but as for now, when European Commission formally only requests, that's what country is saying. That's all the country activists and the government is saying. From drug policy perspective, European Commission require drug agency, drug strategy, and early warning system. That's clear, it is. As soon as you have any drug strategy, you are okay. As soon as you have any drug agency, you are okay. And that's ticking the box. And as soon as you have early warning system, and since European Drug Agency, they are developing it and they are investing and checking this, you are okay. Where is the access to basic health services? Something inside the strategy, I guess. So that's where we are with our reports. Technologically, expert is collecting data from the first legislation, then having the consultation questionnaire with the civil society and community, and then have validation report. And then we have policy paper, and the policy paper for Ukraine and Moldova are already
should be on the website in the next couple of days.
Using this QR code, you will see policy papers. The report itself, we are not publishing because there are a lot of technical details, but we will be happy to convene it to and civil society is seeing it, and they could collect this data next year. And that's annual exercise. And the key point with the publication of this policy papers and this reports is not just another paper. It is a vehicle to connect with everybody, all civil society in the country and in Brussels and regionally, and commission officers and all the specialists, including DG Nest, including DG Sun, including DG Just, to show that there should be this space, there should be questions, there should be place for negotiation. So that's what we encourage our members in the country, accession countries to do. And I need to say that it was our political decision, together with the Line for Public Health, who supported this work, and together with it's money from Global Fund, thanks to Europe to support the Global Fund to fight TB, HIV, and malaria. Our decision was that we are doing it for Ukraine, Moldova, and Georgia. Understand it, and in Georgia, it's very hard now politically question about EU accession, but we need to have baseline. So for these three countries, we're already on the like Ukraine, we are taking from the different sources help with the help of Open Society Foundation, and somehow we don't have dedicated resources, but we are feeding it to have the three reports. And now, thanks to support from UNDP, we could have 5 more with Western Balkans, and to compare and to move forward with this advocacy. Actually, that's key. Let's say what we are doing. The policy briefs for 2 countries will be, they are now finalized after the country consultations, but they're very specific, of course, country specific. Some recommendations for Montenegro, Ukraine, Georgia, and Moldova, I guess you have in this paper, also done in some consultation with the civil society and our members in the countries. So that's where we are, and why we are doing this event here, and why we are sharing all of these methodologies and all of these chapters with everybody from DGs and from the European Commission, and on the level of European Parliament, wherever it's possible. It's to highlight that depends on us what best practices we are delivering to accession countries and what we are asking accession countries. Sometimes even informal question in the corridor from somebody from European Commission could help us in the country advocacy as a civil society. So that was my intervention.
Thank you very much, Julie. The first lady in the region, from my perspective, and I have a great respect to you for all these decades of your advocacy work. The last speaker is Bojan Konstantinov, extremely busy person. UNDP chief policy specialist, human rights and access to health technologies, HIV and health group, United Nations Development Program. Bojan, please make it short. Because we are a little bit behind the schedule, and we're good to have at least a couple of minutes for discussion. Sorry, thank you.
Thank you very much, Chair. It's a pleasure to be here, and thank you very much for these excellent presentations and input. I wanted to say something about the importance of EU accession in terms of really reforming rather than just mimicking change. For a second, I'm going to put on my Bulgarian hat because I come from Bulgaria originally, and we have the bitter experience of actually formally adopting some reforms without really reforming some systems, which ended up backfiring and led to post-accession monitoring for many years. And to me personally, and I think to many people who were following the process, it's a lesson learned that when you negotiate accession, it is better to really reform rather than just put a veneer over something that is not reformed. And I don't think this is the case for Bulgaria only. I'm just using this as an example. So it's important to have presentations like this. And I don't think these are shadow reports. These are reports.
Civil society reports.
Yes, they're civil society expert reports, because this is good, and it's also expertise that is benefiting not only the acceding countries or the candidate countries, it's expertise that is benefiting the European Union, the union that receives these new members. So it is important, I think, also talk to them about that in that context. They do help, they catalyze the real reform rather than the veneer. And why is this important for UNDP, and why are we partnering with the Eurasian Harm Reduction Association on producing these reports and with Czechia on convening a discourse around how to really introduce this reform? Well, for one thing, because responses to drug challenges are going to be more effective, more efficient, cheaper, if they're done in a reformed way, informed by reformed drug policies and practices. And then also UNDP is a core co-sponsor of UNAIDS, the joint UN program on HIV, and Eastern Europe is actually a region with a growing HIV epidemic, whereas in other regions that previously had huge epidemics, we see a decrease. We also see in the Western Balkans an increase of HIV among people who use drugs, and at the same time, really easy to achieve, and yet not there, harm reduction and prevention programs and policies. So there's a lot to be done on all these fronts with relatively little investment, traditionally speaking, of course. So this is a strategic window of opportunity, and it should not be missed. Thank you very much.
How can you do it? So we have a couple of minutes for discussion. You probably all know Anton from Input. You are the first.
Thank you, Pavel. Yes, another Ukrainian in the room. Yeah, and it's good to be not just Ukrainian in the room, but also to be like I'm a person who uses drugs, person who's been living with HIV, and in this sense, I'm a practical connection between drug policy of Ukraine and drug policy in EU, because I'm now based in Brussels, in Belgium, and I have all my access to like realities of drug policy in Belgium and access to all services there. And of course, I can compare, but being still Ukrainian, even based in Brussels, of course, I have my observations and some concerns about this way of Ukraine to on EU accession way, and situation with adoption of Ukraine drug strategies is super good sign of what Anna mentioned to tick the box, because we as community and Ukrainian Drug Users Network, we were part of this working group under the Ministry of Health, which worked to develop drug strategy many years. But that once our last strategy ended in 2020, 150 versions of new strategy was circulated, but it was never adopted. In 5 years, country lived without any strategy. And then when deadline of EU reporting came, in one night, it appeared on Ministry of Health website in the public hearings. Nobody was, of course, well aware of civil society. So we caught it, we gave some comments, but yeah, and then it was adopted. And of course, it's not the perfect strategy, and it's still a lot of question: where is the window for degree? Where is the harm reduction is somewhere there, but still it's a lot of question about the quality and then further implementation of this strategy. So this is how it works. And then also I want to bring another perspective because this morning there was another event with Ukraine about balanced drug policy in Ukraine in the context of war. And actually war brings, of course, specific reality to us as community as well. But because EU accession, and this is also potentially or used as one of the way to maybe defense Ukraine in the future, like we all hope that war ended, and then so but war brings another reality, and it's something which can or should be also addressed. I understand it's a sensitive issue, but as all EU member states are our allies, part of different coalitions and supporting funding or weapon or whatsoever resources, trainings, I think you have a moral right to draw attention of Ukrainian decision makers or government if you see some human rights violations and what now happening with mobilization of opioid agonist therapy patients who has medical exclusion criteria not to be mobilized, but they are caught, nobody paying attention to their document. It's all patients of even state funded programs, official OET program. But yeah, and then of course it's interruption of access to treatment. Then it's a disclosed fact in the training center or military unit that this person will use drugs, and you can imagine stigma, some kind of tortures. We have some unfortunate suicides, and military ombudsman stepped in with a comment. Yeah, so it's something very special for this time. Sensitive topic, as I said, but we cannot exclude these kind of things also on the way from the consideration on the way to accession. And finally, maybe just about the mechanism of how civil society and community can be involved. So, for instance, time to time, our government representatives traveling to Brussels to report about the progress. But we found out about the last visit just from the post factum post in Facebook from a person who works in the public health center and the Ministry of Health, because she was part of the delegation, but it was few state services or ministries. Me, myself, and as a person based in Brussels, but representing civil society and community, I would love to be invited and to listen to the discussion, so to bring maybe another perspective. I understand there is maybe some formalities, but you shouldn't pay for my travel. I'm there. I live between Schumann Square and Plus Lux. It's very easy to go to the Commission or EU Parliament or Council of EU. So yeah, you can rely on me. And when next time Ukrainian government comes, please, I'm fully at your disposal. Thank you.
I think we have just one or maybe two questions, comments, if anybody wants to. Tadeusz.
Thank you. Because Michel was mentioning, you were mentioning both the EU competencies and also orphan diseases, and so I thought I would make this comment because it sounds timely. The European Parliament Research Service has just released a few weeks ago a report in the context of orphan diseases and rare diseases, and it's about the EU competencies in health, and this being an issue. But the report, they actually said that although health policy is a national competence, a wide range of EU-level actions is possible, and they list using non-legislative measures focused on coordination, funding, guidance, capacity building, and dissemination of best practices. So trying to just see where we could possibly fit, even though it's not easy because of the competences.
Thank you. Anybody else? No? Thank you very much. Organizers, thanks to all speakers, and enjoy the afternoon, rest of the job.
Thank you.